Hello, my name is Dr. Bruce Cava, and I'm the Director of Men's Health and Sexual Medicine at the University of Miami Miller School of Medicine. I would like to personally thank you for visiting our website, and I hope that you find it an interesting and informative resource for penile implant surgery. Whether you have erectile dysfunction and are thinking about penile prosthesis surgery, or whether you already have a device implanted, we hope that you find this website helpful. This is the first of a series of webcasts on our site that provide you with a timely look into various aspects of sexual health. In it, we hope to provide you with an overview of sexual health, its importance, and a focus on male erectile dysfunction. Over the last 15 years, it has become quite clear that sexual problems are highly prevalent in the population worldwide. It is hard to imagine watching a sporting event without seeing at least one advertisement for one of the very popular erectile dysfunction drugs. Most people don't know this, but studies have shown that women equally suffer from sexual problems, although much less is known about the cause of these problems as well as effective treatments. That is a subject for a future screencast, but today we will primarily focus on one of the more common male sexual problems, erectile dysfunction. Erectile dysfunction is defined as the inability to obtain or maintain an erection of sufficient rigidity or duration for satisfactory sexual activities. As you can see from this graph, the prevalence of erectile dysfunction increases as men age, from 40% of men in their 40s to close to 70% of men in their 70s. Not only does the prevalence increase with age, but the severity of the erectile dysfunction worsens with age as well. The numbers are staggering, in that overall 50% of men between 40 and 70 have erectile dysfunction. In a time in which every healthcare dollar spent is scrutinized, many people have questioned the importance of erectile dysfunction in the healthcare agenda. While sexual health is a major contributing factor to overall quality of life for both men and women. This data from more than 1,200 men from the National Health and Social Life Survey shows that men with erectile dysfunction are 4.5 times more likely to have low physical satisfaction, 2.5 times more likely to have low emotional satisfaction, and 2 times as likely to have low generalized happiness as are men with normal erections. Erectile dysfunction has been associated with loss of self-esteem, higher incidence of depression, and may lead to an increased risk of suicide. Therefore, erectile dysfunction must be a consideration in any healthcare planning strategies for the future. Erections are a complex physiologic event which result in an increased blood flow into the penis. In order to understand this, let's take a look at the penile anatomy. The penis houses 2 erectile bodies called the corpora cavernosum and the midline urethra, where males usually pass urine through. As a man gets aroused, there are 2 arteries in the center of the penis which open up and allow more blood flow into the penis. The blood then fills the smooth muscle-lined sinusoids within the parenchyma of the penis itself. And as these engorge with blood, it compresses these small veins called the emissary veins that normally allow the penis to drain. As this occurs, the penis gets engorged with blood. As we can see here, the cavernosal arteries are dilated, the sinusoids are filled with blood, and the veins are compressed. As a result, the penis becomes longer, wider, and more rigid. Now that we understand that erections are mediated through blood flow, you can see that anything that can interfere with the blood flow into the penis will make the erections less rigid and cause some degree of erectile dysfunction. There are several medical conditions that have been noted to be associated with erectile dysfunction. These include age, diabetes, hypertension or high blood pressure, dyslipidemia or elevated cholesterol. Low testosterone levels can also cause erectile dysfunction and should be assessed by a simple blood test in patients who present with erectile dysfunction. Finally, there are a number of medications that are associated with ED. Cigarette smokers, particularly those that continue to smoke, are highly prone to developing ED, as are patients with depression and alcohol abuse. Lifestyle modifications are always recommended in order to help improve your overall health, as well as erectile function for men. Eating healthy meals that are rich in fiber and low in fat is one manner of reducing cholesterol and heart disease. Exercise and weight reduction similarly are heart-healthy and sex-healthy activities. Stopping smoking, getting better sugar control, and reducing alcohol consumption are other healthy activities that will improve your overall sexual health. We now have several medications that are extremely effective at treating erectile dysfunction. A group of prescription drugs called the phosphodiesterase or PDE5 inhibitors are widely available and include Viagra, Levitra, Cialis, and now Stendra. These are extremely effective first-line therapies for patients who have erectile dysfunction. One must always remember, however, that these medications should always be used under the care of a physician. The drugs should never be used by patients taking nitroglycerin or any other nitrate-containing medication. They should also be used with caution in those high-risk situations in which a patient has had a heart attack within the last 6 months, an arrhythmia, or low blood pressure. We found this cute cartoon showing another problem that may be associated with the use of phosphodiesterase inhibitors. While the PDE5 inhibitors are highly effective, they unfortunately don't work on everyone. In fact, in this study evaluating Cialis, the medication was ineffective in 50% of diabetic males, 40% of males with hypertension, 30% of men with heart disease, depression, and enlarged prostate. So what options do I have if the pills don't work? These are several second-line therapies that are available. They include the use of penile injection therapy with a medication that can cause improved blood flow into the penis. The vacuum erection device is another manner in which patients can get erections when the pills don't work. Finally, there is a suppository called Muse that can be inserted directly into the urethra where it dissolves and allows the penis to get erect. Unfortunately, these agents are often painful, difficult to administer, and have some side effects like causing a prolonged erection. They also may be quite frustrating for many patients who are looking for an easier, more spontaneous manner in which to have better intimacy with their partners. This brings us to penile prosthesis surgery, which is a highly effective surgical treatment for men with ED that is refractory to other medical therapies. It is associated with very high patient and partner satisfaction rates. Here at the University of Miami, we have a very rich history in evaluating and treating men with erectile disorders. In fact, many of the pharmaceutical and technical discoveries related to sexual medicine have come from our very own center here in South Florida. I have personally performed over 1,200 penile implants over the last 15 years, and I am happy to say that we have among the highest satisfaction rates and lowest complication rates in the world. It is the combination of experience, innovation, and personalized care that you receive here that makes our center well suited for your needs. Here's just a list of some of the publications, many of which we have written on satisfaction associated with penile implant surgery. Whether you already have a penile implant that is malfunctioning or infected, whether you're thinking about having your first implant, we at the University of Miami are your destination for experience, innovation, and considerate care in penile implant surgery. Thank you, and I look forward to seeing you soon. We have offices located in Miami, Plantation, and soon at our new men's center in Boca Raton, Florida. To set up an appointment, call my office at 305-243-4562. Thank you.